So I'm back again. Sorry, my line is very poor. I've introduced Dr. Yong. She's a registered traditional Chinese medicine. So I think without wasting more time, I will just pass the floor to Dr. Yong. Dr. Yong will talk about the concept and philosophy of traditional Chinese medicine. So Dr. Yong, you can talk.
Thank you, Dr. Wong, for your kind introduction. So I'm a lecturer from INTI, teaching traditional Chinese medicine course. It's a 5 year course in our school. Basically, nowadays, our MQA, Malaysia Higher Education, actually recognize now Chinese medicine as one of the course 5 year course, a medical course in Malaysia. So we are currently teaching in INTI now. Actually, INTI is already offered for over 10 years for this course. So now I, as an alumni also from the uni, and going back to teach as a lecturer. And today, basically, I'm going to have a brief introduction about the concept and the philosophy of what is traditional Chinese medicine. So I think most of you have seen or maybe get to know TCM, a short form as TCM, in this kind of forms. Maybe you saw acupuncture before, or you saw, like in the drama, movies, you see a sensei taking pulse in the picture shown. And you maybe experienced trina massage before, cupping, and also maybe in your daily life, you perhaps you tried our herbs before, just like normal like red dates, barley. Actually, they are part of our Chinese herbs. So how do we actually prescribe, or actually how do we choose what type of treatment to our patient? It's actually now our student will learn in this 5 years course, which is quite intense course. And this Chinese medicine is actually, the theory actually is developed over thousands of years. So we have a lot of literature, classic literature that is recorded and written, a lot of treatment, disease in the record, especially the earliest one. Maybe perhaps some of you may heard before, Huangdi Neijing. In English, we are known as the Yellow Emperors in the classics from 3rd century before the century. So it was really long time ago. And of course, we have others, a lot of classics. But I'm not going to introduce those classics or any history about that, but I'll just put straight into the point. What are the concepts about TCM? There are two concepts you have to know about TCM. It's these two words, holism and syndrome differentiation. So basically, all our theory and our treatment are surrounding, or basically is according to these two concepts, which is the holism, the first one. So the holism is actually meaning that there are different parts of us are actually all interconnected. And we always learn that we look a body from a patient, or we look at the patient as a whole. And also, not only our body, but we also connected to our surrounding. For example, it's quite a very straightforward example here. You see in the picture a bright hot sun. And how do we actually affect you? Just like in the picture, we will sweat. We'll feel that our body temperature rise up. Our face will be red. So the surrounding is actually affecting us, affecting our body. Our body is actually responding to the environment. So actually we are connected to the nature. So this is also learned in Chinese medicine, that we have to observe, or we have to feel the surrounding, anything that happened in the surrounding actually is affecting our body and affecting our balance inside our body. Like the other example here is, it's quite cold. You can see during a winter time, a lot freezing is here. So, or during these few days of the last Chinese New Year, you all can feel that it's all raining all the time during the Chinese New Year, right? So how do we actually feel? We feel cooling. We don't feel hot like previous years. So we will wear maybe a long sleeve. We will bring umbrella. This surrounding is actually affecting us. So we are connected to the nature. While during the hot days, we will wear lesser. We might wear singlet, or we want to drink cold drinks, like between hot coffee and cold iced coffee. During winter time, we will like to choose hot coffee. Why? This is a very natural response that we will feel in our body, that we need something hot during winter. Why? To balance our function. So this is quite a first step in the concept in Chinese medicine, that something we need to balance it back in our body, which is affected by other things, our surrounding or inside our body. We are also in a balance, like these two pictures here. The first picture is about the 5 elements that we learn in Chinese medicine. The 5 elements is the fire, earth, metal, water, and wood. Some of you might have heard about these 5 elements. And these 5 elements is actually signify the 5 organs in our body. But the 5 organs that show here, like the fire is indicate the heart, the earth is indicate the spleen, metal is indicate the lung, water is indicate the kidney, and wood is indicate the liver. But actually, the heart, spleen, lung, and kidney, liver is not similar what we learn in anatomically, like what we learn it now in science about the anatomical heart or anatomical spleen. Because in Chinese medicine, they already recorded in the ancient time literature, it is a different system. What we mean here is the system, a different organ from what we learn in science. Okay, maybe I'll explain more later. And also another thing, that these 5 elements is also outside the surrounding. So we are interconnected in the body and also with the surrounding. And we actually also have another element in our body, that is yin and yang. This is a basic, also one of the basic concepts in TCM. We will learn that we are relatively balanced all the time with this yin and yang in the body, which is also, we have another type of element we call as qi and blood. To be in simple way to understand it, you can understand it is as an energy, as a vital element in our body. So they are circulating, they are interconnected, and transforming to each other in all the way inside our body. So when these elements are not balanced, they are in imbalanced state. Maybe yin is more, or yang is less, or yang is more, for example. Or the 5 elements, the heart, the fire is too much, the element is over, and the metal is less. Just an example, which means all these elements is imbalanced, so do the environment is imbalanced. For example, maybe some during the summer season, they have like 40 over degrees Celsius over the surrounding. It's too hot, it's like abnormal temperature that we will see during the summertime. It's too over. So there are imbalance in the surrounding. So it will affect our body. So people will get sick. People will get heat stroke. Or during the winter time, it's too cold. Maybe they will have flu. People will get flu because of the coldness from the surrounding. So there are imbalance between the body and the surrounding. so do internal our body. When these five elements are not in balance, there are something will have some issue, like some disorder will happen. Okay, so this is what we understand in Chinese medicine, that everything is a whole. We see it as a whole. We need it to be a balance, and it is actually connected. So come to the function or the system that we mentioned in the five elements. There are some examples I would like to show here. Like just now we mentioned about the five organs. We have liver, we have spleen, we have the heart. But it's not the same with the anatomical that we learn in the science about the liver or about the spleen. For example, in Chinese medicine, we mentioned about the liver function actually control our eyes, control the tears, control the sinews or tendon, and it will manifest in the nails. So if you want to see if your liver function in Chinese medicine is good or not, we can observe our nails condition. Is it pinkish? Is it smooth? Or is it rough? Or is it pale? So to observe that, if there is abnormal like a manifestation on your nails, that means there is something wrong with your liver function, so-called within the Chinese medicine concept. And like in the spleen function I showed here, it controls the saliva, it produces blood, okay, and also it control muscles. So for those muscles who is really weak or the muscles is atrophy condition, in Chinese medicine, when we observe that or we diagnose that, we will look deep into the spleen function in Chinese medicine. So it's a quite different way of looking at the organs, at the functions in Chinese medicine compared with the science that we learn now, okay, with the anatomy and the physiology that we learn now. But during the 5 years course, our students will actually learn the physiology in modern science, but also the theory of the Chinese medicine about the functions and the organs in our theory also. So they have to learn both, and they have to actually absorb the knowledge from both sides and to know how to link the connection about it. So when we get to learn about every organs have different function and different manifestation, meaning that when we observe someone in Chinese medicine, we can look the whole body, look their eye, look their ears, look their nose, their mouth, their tongue, to know what happened inside in them, because we look it as a whole, it's interconnected. So this is the first concept. The second concept is syndrome differentiation. This one also a very special concept in our TCM. It is only, we have this analysis very specifically to diagnose our patient. It's a procedure to analyze the symptoms that we gain from the patient. Like I mentioned just now, we observe them. We have to diagnose them by the symptoms that it manifested on superficially. And then we only choose the proper treatment according what we diagnose after that. So this is actually a very big difference between the modern medicine now and our traditional Chinese medicine. But because in modern medicine, we have to differentiate disease. We have to diagnose, okay, this patient, what disease he has or she has. Like, okay, she has hypertension, or she has autoimmune disease. We have to differentiate the disease by using blood tests, using MRI scan, ultrasound. We have to using the modern techniques or the equipments to differentiate what disease that she has now. But in Chinese medicine, in traditional Chinese medicine, not only we have to know what disease they have, we also have to differentiate what syndrome they have. the syndrome here is quite different than what we understand in modern medicine. The syndrome here is a Chinese medicine syndrome that also we will learn that to differentiate or to compile what symptoms do they have. Further explanation, for example, I'll explain a brief explanation like how do we actually diagnose in Chinese medicine, in traditional Chinese medicine. Like few ways. First way, to inspection. Okay, we will observe the patient's condition. I believe, of course, in modern medicine, we also will observe the patient, right? So later I will show some example. And then by listening and smelling olfaction, so we known as by listening, by olfaction, by inquiry. This not only in TCM, of course, in modern medicine, we often have to ask patients questions more about their medical history and so on. And also, the special method that we have is pulse taking. We have to feel the pulse from the patient. I'll elaborate more later. And also palpation. Palpation, I think, yeah, in modern medicine, we also palpate patients, right? To percussion, to palpate the particular area that they feel pain and so on. So in inspection, our Chinese medicine is actually broader. We have to look into many ways and many parts of the patient. For example, the complexion that we see in the patient in the first impression. Is it red or white, yellow, bluish or black? Because these 5 colors also indicate the 5 elements that we showed just now, which is the fire, the water, the earth, metal, and so on, right? So it could be signify or indicate the organs that have some disorder or the impairment in the function. So they will manifest on their complexion. So this will actually help us to diagnose what condition that the patient having now. Not only the complexion on the face, but also complexion on the particular region or area that they are feeling uncomfortable or they are having some problem there. And also, we will inspect not only complexion, but the size of the body. Is it in a big size, the patient, or the patient is very thin? And also, is it any like any swelling nodes on a particular area? So these are all based on inspection. We also inspect the lips color. So the middle one will be the best lips color that we have, like pinkish, and it's moist and luster. Whenever the patient having heat in the body, the lips could be red, okay, or dry in the body. It's lack of body fluid, that it could be some dryness on the lips, okay. Like if your lips color are purplish or dark, like the left picture here, it could be signify or indicate there are some blood stasis in your body. And also some pale color of the lips, it might show some insufficiency that show in the body, might have what we say is the energy in simplified form, like qi, our blood, yin, yang, insufficiency. When the vital element is insufficiency, it could show pale lips, okay? And the most important thing that in Chinese medicine, we will inspect on the tongue. This could be quite different in other, with the modern diagnostic way. Because inspection of the tongue, we will inspect 2 ways, the tongue body and the tongue coating. The tongue body, we will inspect the color. For example, the first one, is it red? Okay, the middle part will be the best tongue color that we have. It's pale red, some pinkish, okay, and moist, okay, but not too wet, but just moist and nice. And the coating is actually thin, not too thick. But now we first observe the tongue body. Is it red or is it pale white? or is it purplish? So what type of color the tongue body show will actually indicate what happened in their body. Like the first one, if it's red color, it could be the patient having some heat in their body. This heat in Chinese medicine can be in simplified form is the energy is too much inside the body. It will cause some hot sensation. You might feel some dysphoric feeling, and you could have some other symptoms that will show. So in your tongue body, it could be showing red color, or your complexion, it will show red. The same thing like when you are under the hot sun or during the summertime, you are having heat stroke. Sometimes it will show like red complexion on your face. So same thing, it will show the same thing or in your tongue body also. It will show red color, really red or deep red with your tongue body. Or is it due to weak or cold? The color will show as white color on your tongue body. Or is it your blood circulation is blocked, is stagnated? It will show the purplish color, stasis. This is understandable. For example, whenever you like squeeze your hand too tight, like you wrap around your wrist, then it's too tight, you will see purplish color on your finger or on your hands because the blood circulation is stuck. Same thing, it will happen to your tongue. It will show purplish color. So whenever we saw this, we might choose the proper treatment or the proper herbs to help with balance it back or regulate it back or reduce the stasis of the body condition inside the patient. Okay. And also we will see whether the tongue body is it rough or is tender, like the picture shown here. You know, when we choose the raw chicken meat, especially the chicken breast meat, before it was cooked, you can feel the tenderness, right, with the raw chicken meat. Just like the tongue will show here at the right-hand side, you will see the texture of the tongue body. This might indicate the body condition of yours could be in a cold condition or weak condition. But if, for example, you think of the chicken breast meat overcooked, when you overcook your chicken breast, how does it feel like? You will feel like the meat is rough, right? Why do you overcook? Because the heat, the fire is too much. Same thing, what will happen to your tongue body? Because our tongue is made up of muscle, right? So if you are having heat inside your body, your tongue texture also will become rough and dry, just like the left-hand side, the left side picture shown here. Beside the tongue body, we will also see on the tongue coating. So like I said just now, the middle one actually is a very good condition of the tongue coating, which is very thin and moist. What you see here, the tongue coating is quite thick, like the red color, the red color tongue here. You see yellowish and thick tongue fur, okay? So the left-hand side is white color of coating, and the right-hand side, the most right-hand side is black color of the tongue coating. So this will also indicate different condition of the body condition inside internally now. So not only to see the color of the coating, we also will see whether it is greasy or the coating is too thin. Sometimes you even don't see any coating. It could be due to some condition, like we indicate here, the greasy tongue coating could be due to dampness. Okay. What we show is dampness here is another special word in Chinese medicine also. It's quite a different thing that is, if I simplify it, it's like you have a lot of sticky things inside your body. So the patient will feel heaviness because it's sticky inside, or it will have some unsmooth pass motion. Whenever she or he pass motion, the stool will feel sticky, loose. So this will signify there is some dampness inside your body. And also we have some herbs, some treatment to get rid, to reduce the dampness inside our body. And of course, we have to observe, inspect whether our tongue is dry, slippery. So it indicates different things. So inspection, like I mentioned just now, we have to inspect a lot of different parts of body. Whenever our patient comes to us, they will tell us, okay, doctor, we have uncomfortable at maybe I have coughing, I have headache. Okay, once they started to mention about what they feel uncomfortable for, we will start inspect the patient's condition, inspect, like for example, their eyes, their ears, their nose, and also we inspect their tongue especially. We will look at their tongues, just like how we looked at just now the few pictures that I shown there. There are more complications, but I can't show every of it. So I showed just some example here. So beside inspection, we also will listen and try to maybe we'll have some olfaction technique during our diagnosis. For example, what do we actually listen? We're listening to the patient speaking volume. Is it loud and clear, or is it soft, no energy to talk, or it will like breathlessness during the speaking? Okay, this will actually help us to diagnose what kind of treatment we can help them. And also coughing. We listen to patients coughing to try to differentiate whether the coughing is dry without phlegm or coughing with a lot of phlegm. You can hear the noise when they cough, you know. And also the heartbeat. Of course, we will listen to the heartbeat sometimes. Is it regular or irregular? And the speech, is it normal? Like what we ask them, are they able to answer it in the normal response? Okay, we will indicate to the heart problem if it doesn't answer in the proper way, or it could be has some retard response. We will actually think of the heart function in Chinese medicine. So for the speaking, we will indicate or think of the lung function in Chinese medicine. So it's quite different. And about the vomiting, hiccup, burping, this also the sound or the how they actually like some will burping in a very loud voice, but some burping is like is not in low voice. For example, some hiccup also they will feel very suffocating. Okay, this will actually help us to diagnose if we are able to listen to it, because we will learn how to differentiate what type of sound actually indicate what happened internally. Also about kidney function, we actually will listen to the speaking ability, speaking volume, also the urinating sound. This can be understand, like, is it urinating smoothly, or it has some stopping during the urination. So we will think of the kidney function here. For the olfaction, meaning smelling, sometimes we could smell something from our patient when we diagnose or we seeing them. Especially sometimes like Chinese medicine, TCM way, we will meet a lot of aging patients. So whenever the aging patients or the patients that is lying on bed, we will smell something and we can diagnose with the smell. Like some will have some strong urination smell or pungent urine smell. We can indicate them they could have heat or dampness in their body. Or some people might have bad breath or some sour smell from the mouth. we could indicate them as there are some food accumulation in their stomach. So we could use some different herbs to help them. Same thing, if we smell some bloody smell or putrid smell, it could be indicate different condition. So we do actually learn about listening and olfaction, and we will teach the students to how to differentiate what condition could be indicated, what kind of symptoms that we show. For the inquiry part, it's actually quite common. No matter in Chinese medicine or in modern medicine, we do ask patients a lot of questions, especially about their personal details, their complaint, and their medical history especially, right? It's just that the way that we're asking in Chinese medicine is quite a bit different. That, for example, when we ask about fever and chill, so normally when we, in modern medicine, where we get to know fever and chill, we can like, it could be due to common cold, common flu. So you might use some paracetamol and stuff, right? But in Chinese medicine, we still have to differentiate it. Like if you have fever and chill, we have to differentiate. Is it you feel chill it more than you feel the fever? So it's very, we have to communicate with the patients. Or the fever, the temperature is very high, severe fever, but the chill is okay compared to the fever. And we have to collect other symptoms. For example, we have to ask, is it you are sweating or not sweating? Do you have any body pain, nose block, or any nasal discharge at the same time when you're having fever? Because it could be signified two different conditions. For example, I written here the left-hand side. It has severe chill, but mild fever, and the nasal discharge is clear. Okay, nose is blocked, body is pain, no sweating. Then in Chinese medicine, we will choose and we will diagnose it as maybe it is due to cold. So we will choose the herbs to relieve the cold. Okay, but for the severe fever, we have high temperature, mild chill. It will have the patient will have sweating, sore throat at the same time, and the nasal discharge is yellowish color. Then it will be different condition. Then we won't be using the herbs that to relieve the cold. We will diagnose it as they are having heat internally. We have to use the other way around of the treatment. So same disease or same disorder, same patient having same fever, but they could have different other symptoms. And when we collecting it, we analyze it, the syndrome or the condition could be different. Also in pain, when we inquire on pain, patient will say that, okay, I am having headache, for example. We will have to ask, where exactly is your headache located? Is it forehead, temporal part, occipital part, or the top part? Because different location indicate different things happen in their body. Also, the sensation of the pain could be different. We have to ask, is it your pain is distending or puncturing pain or dragging, or it's just a mild pain, dull pain that you feel? Because the causes, the syndrome that we have to differentiate is different. Right. We will ask about appetite also. Is it you are having low bad appetite, or you are having frequent hunger, you keep hungry? So in Chinese medicine, it's different, the condition. For the low appetite, it could be due to the weakness of the stomach, the weakness in the digestion, or it could be due to dampness. And for the frequent hunger patient, we say that they have some heat in their body, in their stomach, and so on. Okay. Defecation also, we will ask about the pass motion. How's the patient feels about their pass motion? Is it constipated, or they are having diarrhea, or they are having dry stool or having loose stool, because it could be due to any causes. So we have to gather the information. Same thing to the urination. We will ask what color is your urine is. Is it clear or yellow? Because the condition could be different. It could be weak coldness or damp heat. And not only this, we ask about like if some disease is related to the gynecology diseases, we will ask about like, for example, menstruation. Same thing in Chinese medicine, we will ask whether the menstruation is on time, or is it become earlier, or it is delayed. Then we have to diagnose in different way. And also the menstruation volume, is it less or is it too much? Then it could be due to different causes in our Chinese medicine, and we have to diagnose it, have to differentiate it, and we have to treat that. Same thing to the color of the menstruation. Even we will ask, is it pinkish, pale, or it is dark, or sometimes if you have some blood clot in your blood, it's different. What we use the medicine or the herbs is totally different because different condition. Even the leukorrhea, what are the texture, the color, also signify different things happen in the body. Now comes to the pulse taking. That is one of the special thing in Chinese medicine is we will actually feel the pulse of the patient, because different patients have different pulse. And what we look here in the picture here, we have two hands, right? Actually, for us in TCM, two hands indicate two different parts of our body. Like just now we mentioned about 5 elements, the 5 organs. So what we can see here, the both hands actually indicate different organs. So what do we actually feel from the pulse? We are not only feel the rhythm, whether it is regular or irregular. We also will feel that it is fast or slow. Strength, is it very strong or weak? And the location of the pulse, is it floating or we have to press very hard, it's sunken, it's deep? And the shape of the pulse, is it very thin or is in round shape? It's very quite hard to imagine, but we have to experience and learn it every time we feel the pulse. So different condition of the pulse, it signify or indicate different things. For the palpation pulse, is actually same with modern medicine. Whenever we palpate the patient, we feel the temperature, we feel the shape of the nodes, and we press to feel the boundary, the texture, whether it's soft, hard, is it painful, and with percussion, we have to listen whether it has a resonance, dull, timpani. These are all the things that our students, we as TCM physicians have to learn all the things here. And in the end, after we collecting all the information, like I mentioned just now, through the inspection, listening, inquiry, and the pulse taking, palpation, we will come to the end, syndrome differentiation, which I mentioned in the second concept just now, which is very special, that we have to analyze into what syndrome they are having in their body. So this is another huge theory and huge concept within in our TCM. We have to differentiate what syndrome. For example, he's having cold syndrome, he's having heat syndrome, he's having deficiency, and there's a lot of type of syndrome that we have to learn. We have to analyze and differentiate. Then only we choose different or proper method to treat that. Like a case study, for example, I choose a simple case study. The patient having diarrhea 2 days. And we will look at the patient. The complexion is white, pale. Okay, the lips also pale. The tongue also pale. Okay, you can see the tongue body is pale color. And then we will ask, how's your diarrhea? Is it very watery or is it sticky? And the patient maybe will mention it's is loose and it goes to the toilet quite frequent and is very watery, and she's having abdominal pain. And when we take the pulse, it's very slow, it's deep, and when we palpate the abdominal area, it's cold sensation. Then we will maybe diagnose that, okay, she's having internal cold syndrome. There's a cold inside the abdomen area or in the stomach area. Then we will have to choose the herbs to help her. The second condition, another patient with the same condition, he has a diarrhea for 2 days, but you can see the complexion is red. He's having fever, and the tongue is red, and the coating is yellowish and thick. And when we ask about the stool, it's sticky, yellowish, and strong smell. And he also has the same painful sensation on the abdomen area. But when we take the pulse, we feel the pulse is fast, okay? And we take the abdomen area is hot sensation. Different syndrome that he has. He could have internal heat syndrome. Then the method is different. One is cold, one is heat. Then we use the herbs, it's totally different. So this is the second concept in our TCM, that we have to know what to differentiate during our diagnosis, which is the syndrome differentiation. Not only we have to differentiate what disease he's having now, but we also have to differentiate what syndrome, what condition that he is having now. Then the philosophy of our treatment is to balancing and to regulate it back, to restore the harmony in it. That's why we choose all different kinds of treatment that have different actions. Yes, we have over 400 herbs, you know, so we have to learn every type of herbs and to learn what are the properties, what are the function, and what is direction. Where does it go? It go to the lung, it go to the stomach, it go to the kidney, and is it cooling or is it warming? Is it strengthening or is it reducing? So there's a lot of things that we have to memorize, especially the herbs, so that we can choose the correct one, the proper one to treat the patient. Also, the acupuncture, that maybe most of you know about acupuncture, you might have not known that we have over 300 acupoints with different pathway, different meridian, different functions. We are not choosing the points that is related to the muscle or based on the anatomy. We are actually choosing the points due to its function, its meridian, the direction that it goes. So we will also have some different methods like acupuncture with strengthening way, reducing way. They have different manipulation method. So our treatment area is quite wide. We can treat a lot of types of disease actually. And nowadays we also have a lot of research. No matter is in, you can see in Google Scholar, you can see Hindawi journals, medicine journals. There's a lot of TCM treating the chronic diseases like hypertension that I show here, even in coronary artery disease, angina, and also coughing. Of course, coughing, I think most of you know already, maybe coughing, especially like post-COVID, having coughing, we actually can use Chinese herbs to actually balance it back, the lung function, and also to regulate it, to restore the harmony in it. And there's a lot like asthma, even for gastritis, for chronic gastritis, IBS, menopause syndrome. There are a lot of the articles here actually can show. I won't mention everything, but the most importantly is we can restore the harmony of the body condition, because like what we mentioned, the first concept, we see it as a whole. So what is imbalanced inside, we have to restore it back. But the difficulty of the TCM way is you have to diagnose it well. Like you have to make the correct diagnosis so that we can choose the correct medication, correct herbs to treat it. But of course, it's not every type of disease we can treat. For example, some disease might need some surgery. For example, the appendicitis, impossible we use herbs to treat it, right? Because especially for acute stage of appendicitis, you should confirm you might need to have the surgery, or some accidents that need some surgery. Of course, that is for we need the surgeons to help. But for the internal problem that is imbalance that you feel, the TCM is another option or the alternative way that actually can help to restore it back the body function or the body condition. That's why we have to take so long of time to learn about this course, which is 5 years, not including the PU course. And also we have to further study some more, like master course or PhD, 3 years, 3 years. So in total, we could need 10 over years to study the whole thing about it. And of course, I mean a lot of clinical experience. So today, this is what I want to introduce about TCM in this sharing session. I think this comes to the end, and thank you for listening.
Okay, thank you, Dr. Yong. I want to share my own experience. Many years ago, when I was working as a junior doctor, I was quite stressed, and I have a lot of bowel irritation. I have diarrhea, chronic diarrhea. I've done all the tests, the Western scopes and all that, and couldn't find a reason for that. So the probable diagnosis may be irritable bowel syndrome.
Yes,
And,
yes.
But finally, I saw a TCM doctor, and he gave me some herbs, and the condition resolved within 1 week. So I want to ask you, my question for you is that, what are the conditions that will be ideally treated by your TCM instead of our Western medicine?
Ideal condition.
Uh-huh.
Okay, if you want a really specific answer, because sometimes we might thought that TCM can help with chronic condition of a disease, which means maybe you won't see any effect from the medicine, like what you mentioned, the IBS, even you check, nothing happened, but you still have the symptoms. You can try or you can choose our Chinese medicine, meaning that patient did feel uncomfortable with the body, but by checking, there's nothing wrong, like in tests or anatomically, the cell, that there's nothing wrong about it. Then Chinese medicine can actually help to relieve the symptoms that you feel uncomfortable. I think that was one of the ideal conditions that it can be like simplified.
Okay. Another thing I want to ask you is that some of your herbs may interact with our medicine, such as blood thinning medicine, because
yes,
some pregnant ladies, after they give birth, so they took some of these herbs, and it caused more bleeding. So can you tell us what are the herbs that some of them took it as a part of their diet, and like the ginseng and all that?
I see. Understood. Yeah. So that's why our students nowadays have to learn pharmacology, meaning they have to know what are the blood thinner medicine, like maybe aspirin, warfarin. They have to learn, have to get to know, so that when they prescribe, they have to avoid that is Chinese medicine that could have the same function with the aspirin or the warfarin. So if it's in no diet, could be happen is tang kui. Tang kui is actually will invigorate the blood also. We will push the blood circulation more. So actually we will ask the patient to avoid if they are having pregnancy or having taking some blood thinner medication. Also, there's a lot like 田气, dansen, there are few. Unless they have to choose one. Either you only take the Chinese medicine herbs, or you take the modern medication that has the same function without overusing the function of the medication, that it will cause the other way around, like you mentioned just now.
Okay, there's a question from the floor. It's from Dr. Tajuddin. He said, can we diagnose pregnancy in traditional Chinese medicine by radial pulse? So
A very good questions. Yeah,
my other question for you is that, let's say both their hands have been amputated. How are you going to make the diagnosis? Because from what you said, it's mainly human diagnosis. You don't use any tests. So if they have no hands, how do you make the diagnosis then?
I think these two are very good questions. Okay, but the first question is quite interesting. Diagnose pregnancy with the pulse, right? Then you have to gain a lot of experience actually. For first learner, I think it's hard for them to get to know how to diagnose the pregnancy, because the pregnancy pulse with the pulse that before menstruation is quite similar. Before menstruation, we will have a pulse that is very strong, powerful. Okay, for the pregnancy woman, especially the first trimester, without taking any pregnancy test, it was quite similar. So for the beginning few weeks, for a beginner, it's quite hard for them to diagnose their pregnancy. So actually, we have to asking the patients more. Is it you are having, sexual intercourse without any proper, a lot of things we have to avoid, especially now in the modern days. So we will ask them to directly to take the pregnancy test, not only by our pulse, but we could have for some experienced doctor, they might know how to diagnose the pregnancy very accurately. But it takes time. You need a lot of clinical experience to differentiate the pulse. And for Dr. Wong, what you mentioned just now is about what if the patient doesn't have or amputated arms, hands. Okay, that is why our diagnostic method is not only pulse taking. Just now what I introduced, you can see we will have to inspection, listening, olfaction, inquiry. So the tongue will help. Actually, the inspection of the tongue is very important, not only the pulse. For the drama or movie we see, is always seeing the pulse taking only. But actually what we learn is we have to gather all information, especially the tongue. We have to also diagnose the tongue. So for those patients who really, amputated or something, we can see from other aspect, the tongue, through inquiry more, that different aspect. Yeah.
Okay, Dr. Yong, there's a question from another Dr. Yong. He asked about this method that's been spread in the social media. When they have a stroke, so they use those
pricking needles,
pricking the fingertips and also maybe the ear. So what do you can you give you your comment about this method?
Yes, good questions. Okay, pricking tips, or this is one of the treatment way that we learn in Chinese medicine. We also known as bloodletting, meaning you have to let it bleed a bit. Okay, for stroke patient, actually we also need to differentiate first. Like what I mentioned just now, we have to do the syndrome differentiation. Why there are some like rumors, or there are some very many like share in the internet that the pricking did help, is because for some syndrome, for some condition of the stroke patient, do suitable by using the pricking can help. But like I mentioned just now, we have to diagnose. For some stroke patient, is not suitable. That's why it's very important we teach our students, we have to differentiate the condition. For those who are really having high blood pressure, purplish lips, and they are always very easily angry, dysphoria condition. If they really are almost having the pre-stroke symptoms, we can do the pricking. That one okay for the strong body type of stroke patient. But for those who are really thin, it's not suitable. That's why we have to diagnose. Actually, they are if efficient, but for some people, yes, but for some people, no. So different condition might have different way to help.
Okay. There's a question about some of the herbs that you use, and even in my own practice, I find that some of these herbs, when they take it, they have this diuresis effect, and it's just not just water diuresis; they also have sodium diuresis. So when we do the blood test, they have hyponatremia. So, so for you as a TCM, how do you know that your medicine may cause harm to the patient? Because if all patient that they become hyponatremia, they can get into serious problem. So how do you decide whether they can take, and how do you monitor them?
Yeah, that's why we often giving a lot of education now that patient need to choose the right doctor, especially TCM physician. So nowadays you have to choose those doctor who really study 5 years course, no matter in Malaysia or in China, they have proper education to know how to use the herbs and to diagnose the patient properly. We do educate our students. That's why because last time in previous centuries, previous time, we don't have a proper management, proper association to control the quality of the physician. But now actually KKM control our license. KKM are those who give us license. So we need to have proper certification, proper education, then only KKM will give us license. So the patient actually need to check the physician whether they are qualified and they have the license from KKM. And for those who are really qualified, normally they will know how to diagnose properly and will not use the herbs like overly abuse or choose the really wrong medicine. That I can say that. Okay.
So is it the same as the Western doctor, where you have an annual practicing certificate that you have to renew every year, and to show that you have this CME points? Okay.
Yes, exactly. Now they are controlling now. Our license will have to get from KKM now.
Okay, and the other question that I also want to ask you is that because you don't use any diagnostic tests, how do you know that the patient is serious, that you cannot manage and you have to send to the Western doctor? I mean, you mentioned the obvious one, like the surgical acute appendicitis, but other patients, like maybe they may have some chest pain, but maybe they are having a heart attack. But because you don't do ECG, how do you know that he is having a heart attack?
That's why in 5 years course, we do learn about allopathic. We need to learn allopathic. We need to learn pathology. That's why 5 years course. It's like we have to learn the modern diagnostic way also. So we do teach students these things, like the Murphy test, the similar palpation test that we need to learn in our first course. So when they have this positive sign show, we will ask the student to send them or refer them to the hospitals. Even with stroke patient, we do the pricking fingers also. Actually, if even we will ask the patient to go to the hospital for further checkup. Not just by pricking, but you also need to stay over go for hospitalization, go for further checkup, check whether your heart and your brain, is it any, ischemic or what, you have to go for checkup. It's not only get treatment from us. So nowadays, we also educate the same thing to our students. You can't take over the patients only by yourself. If the patient is really in emergency case and they need further tests, you have to let them to do for their safety. Yeah.
So there's a question from Dr. Yong. He said, how does TCM treat heart attack patient? So I think heart attack patient, I think it's quite clear. Our Western medicine is better lah. That's what I think. But how about those patients who has chronic ischemic heart disease? They are not acute, but you want to help them so that they don't get a progression of their
Yes,
atherosclerosis.
yes, yes.
What are the things that you can do?
Yes, for acute one, of course, we will refer to hospital for the clinic, and for the chronic one, you can just now I did show there are some research. There are some ways like acupuncture, like herbal medicine that actually can help. But same thing like I mentioned just now, differentiate their body, differentiate the syndrome. Then we only can choose the correct treatment. So that's it. Yeah.
Okay, and in terms of all the treatment that you have that you shown on your picture, they could be cupping, acupuncture, and herbs. So do you use it all together or in combination, and how do you choose what method to use? And
Yeah. This is quite interesting question. Okay, acupuncture for some patients, they are quite afraid of needle. So for those patients who are really afraid of needle or afraid of because for acupuncture, cupping and tuina, there's a bit of not say very painful, but there are some sensation when we do it. So some patients were very afraid of the sensation of the effect after doing it. Then it's okay. Then we can choose herbs to help them. But for some, it's like, especially pain syndrome. Pain syndrome is actually very good effect. It's effective if we use acupuncture combined with the herbal medicine, like in both ways. Because herbal medicines, it can go full body, it treat as a whole. But acupuncture, it could treat specifically in the region that you feel pain. So for the pain syndrome, we will actually offer the patient like accepting the acupuncture at the same time besides we prescribe the medicine, because you will see the effect more, because acupuncture can treat specifically that region. But for herbs, it goes all around. Yeah.
okay, one question that I'm always of concern is that you may know that in your textbook this herb is useful, but the source of these herbs can be different, and sometimes they may put in some other chemicals in there. So is there a standardization of your herbs so that they don't get poisoning from mercury or sulfur and all that? So
Yeah. This is a very good question, but nowadays we have I'm not sure whether is which department. Our government have a specific department to control it actually. So for those who are abuse the herbs by not registering, that one is another problem actually. Yeah. And sometimes it's not under the same department, I could say. So hard to control. Yeah, this one is another issue. Also from the seller, it's not registered seller or not registered under the government. This one is another issue that we concern also. Yeah.
So do you find that this can be dangerous for the patient if he's
Yes, that's why we often tell patients not to buy the medicine themselves. We often will prescribe, which is under our control, and we know that where are the source properly, no matter is it pills or raw herbs. Nowadays they are using, for those are not registered, we are afraid that they are using steroids in the pill form and claiming that this is herbs, and or powder form, they're claiming that it's herbs, which is not registered. And the patients, nowadays we will teach them to check the MAL number, whether it is a registered product from the website. We have a website to check that for the registered MAL. They did printed the numbers and MAL on the product, but sometimes when I ask them to check, it is not registered. So for those who are not registered, I will ask them not to take, or just take from us, which is a registered one.
Another thing that I want you to tell us the differentiation between traditional Chinese medicine and local herbs, because some local herbs is not part of your traditional teaching. Like some people may use misai kuching and all the guava leaves. So from my own experience, the reason why my IBS improved a lot because this TCM doctor, he was from the older generation. He didn't go through your 5 years program thing, but because of what he learned from his mentor from last 100 years. So one of the main ingredients that he used is guava leaves. So the guava leaves is not in your traditional Chinese medicine thing. And he said this is the main thing that helped my IBS. So can you explain to all of us the traditional Chinese medicine and the local herbs? What are the difference?
Okay. I think this is a very good experience from Dr. Wong that he know about local herbs, Malaysia local herbs, and also traditional Chinese herbs. So traditional Chinese herbs are actually, we get it from China. They actually grow, planted, and processed, then shipped to Malaysia, then the seller will sell it. For the local one, like Dr. Wong mentioned just now, the misai kuching, that things are actually planted in Malaysia. And the properties, I can say these are not learned in our syllabus, but sometimes we will organize some workshops to our students also to get to know these local herbs. And we will actually tell them that the local herbs are not fully researched about their function. So if they want to use, they have to understand it. And throughout the workshop, we also will ask some, like what you said, some sensei that is not to undergo the 5 years course, but who really have experience in using the local herbs, will try to explain to us with his experience what are the function for the local herbs. But for us, no, we don't really usually use it that much. Actually, we use TCM, I mean the traditional Chinese herbs, but we'll get to know something like misai kuching and a lot the yutun cao, Sabah grass. We do get to know what are their function, and we will understand what are their properties, like is it cooling, warming, and we try to avoid for some patient that is not suitable for these local herbs. Yeah, but we don't deny the function of them. They do effective, but not fully researched yet. But from the experience from other physicians, they did share what are the functions, and they did know what are the properties in it. Then we learn a bit lah, but we don't really always use for those local herbs. Yeah.
Okay, with that, Dr. Yong, thank you for coming to our channel. And there's a feedback from Dr. John. He said, he thank you for this talk, and also and a few of them have said that they have learned a lot from this talk. So with that, I will stop here and thank you for listening. And I think there's about 140 live audience, and it's quite
wow. Thank you, Dr. Wong.
Okay, so with that, I will stop here and thank you for coming.
And thank you for inviting also. Hopefully, every one of us will learn also from each other. And yeah, we will work hard in future also to try to control the quality of our physicians so that for patients' health, to guarantee their health. Yeah. Thank you, Dr. Wong.